right now we're looking at the vertebral subluxation nerve chart. What that means is just a fancy term for if the joints are not aligned properly or not moving how they should in the body. And basically people ask why they have pain. This is one particular cause. If the joints aren't moving how they should or they're out of alignment, it will cause problems in the body. But it's best to get checked out with a health professional such as a chiropractor who specializes in the back to actually see what's going on. Now you can see here, here's the vertebral subluxation chart. I'm going to orient you. We're looking at someone from the side view of the low back or mid back. So you can see here's one vertebra or bone, here's the disc here, which actually acts as the cushion, and then here's the other vertebra or bone, and then the nerve comes out between these joints here. So we're looking, like I said, we're looking at the side view of the spine. So let me orient you and show you a picture so you can see exactly which area we're talking about. So here we're looking at, obviously this is showing people's posture here, but you can see we're looking at someone from the side view. Here's the head here. Here's designation of the neck, mid back and low back, and you can see we're looking at someone from the side view. So we're really looking at a cross section right through here. So when we go back over to this, you can see this is a normal aligned vertebra. You could see this is a normal spinal disc. There's a lot of spacing here which cushions the back, and then here's another normal vertebra, and then you can see the spinal nerve comes out right between the joints. So if this is in proper alignment, it's moving how it should, this functions optimally. Now if you come down here, you have this vertebra here and this here, and you could see this is not moving how it should, and it's not aligned how it should, and you have a compressed or wedged disc. And this compressed or wedged disc causes pressure, and then this space here is not that large, it's not large enough, and this nerve gets irritated through this area, so when it's coming out, it's actually irritated and it's not having its proper function. So therefore, if these joints here are not aligned or they're not moving how they should, it is going to cause pressure on the body and can even cause pain. Now, it's similar to if someone has a small cavity building in their tooth, and it starts off small, and someone's not necessarily experiencing any pain or problems, but it's there, and as it grows and once it gets to a certain size, it's putting a lot of pressure there, and it then causes pain. So until that cavity becomes large enough to cause pain, it doesn't necessarily mean when someone has a smaller cavity they're going to have pain. Same thing with the back. Someone could have this building in the body before experiencing any type of pain or symptoms, and once it gets to a certain level, they start to experience it. So what you can see through here, this is just a brief explanation of what's going on, which talks about that when these joints get misaligned or not moving properly, which is also another name for vertebral subluxation, it can place undue stress on the disc between the vertebra and put pressure and irritation on the nerve. It can be the disc can be adversely affected, and it can adversely affect the transmission of the normal nerve impulses we see with this irritated nerve right through here. And these nerves go to joints, muscles, but they also go to the organ systems in different tissues of the body. So that can also play a role and be affected. Now, you have to make sure these nerve channels are clear and your body is able to function with peak efficiency, and this is done with, again, a spinal examination, getting it checked by a health professional such as a doctor of chiropractic who looks at the back all day long. So if you have questions, we look forward to hearing from you, and have a wonderful day. And thank you for joining us.